Media coverage was critical to disseminating the message in the target population and county-wide for broader reach. Government officials, the Chula Vista Elementary School District superintendent, community partners, public health department, and community clinics were all engaged in supporting the effort through participation in the media events, including 5210 messaging on their websites and reproducing 5210 materials for broader dissemination. This was a systems approach to disseminating a healthy weight message that involved all sectors in our community simultaneously participating in each step. This allowed greater reach than any single agency could have achieved alone. Next slide, please. This strategy involves changing policies that support healthy eating and physical activity. Our collaborative supported and influenced the Chula Vista School District and YMCA early childhood setting wellness policies through coordinated strategies and a systems approach. All sectors were involved in testing the wellness changes on a small scale at one target school and one early childhood center. This allowed the policy to become a living document and garner support from the community. The 5210 messaging efforts were linked with the broader policy efforts, and 5210 was incorporated into wellness policy materials. Next slide. Over 24,000 kindergarten through 6th grade students in the Chula Vista School District had their BMI measured in 2010, shown on the top map. This data served as a catalyst for change, and it was repeated in 2012 on the lower map. A downward trend is observed on this map, as we see less red and orange, which represent the higher BMI rates. We need to continue to track this data over a long period of time, and we also realize that we do not have information on cause and effect relationships. Our year-long collaborative focused on the green circled school on these maps, but policy changes were district-wide. It is a challenge to link specific interventions to the changes we are observing because there are several activities going on simultaneously. So how do we prove a causal relationship? This has been one of our challenges. Our Healthy Weight Collaborative initiative had a single-year budget of $15,000. Evaluation does cost money, and we challenge funders and academic institutions to find ways to support community-based research and help programs like ours with evaluation. As was mentioned earlier in the presentation with Laura Kahn, it's very exciting to hear about some of the opportunities upcoming. In summary, our collaborative has, next slide. In summary, our collaborative has identified many opportunities and challenges to obesity prevention. Sustainability was built in from the beginning as we formed our team. Finishing our second year of collaborative work, we continue to have monthly meetings. The 5210 messaging continues dissemination across multiple sectors. From a single school, 5210 is district-wide. From a single child care site, it is used county-wide. In the measurement arena, what to measure and how to measure it. While we've seen BMI surveillance data has been useful to our work, we have local BMI data because we are fortunate to have a school district that invests in collecting BMI data. Countywide, San Diego has developed the capacity to enter BMI data into the countywide immunization registry and are looking into ways to add BMI data from other sources, such as schools and other community environmental data. Plus, the state of California has mandated BMI measurement for all 5th, 7th, and 9th graders through yearly physical fitness testing. Funding, as mentioned, there's a huge need for funding, expertise, and additional evaluation resources. Systems thinking is needed when measuring and evaluating policy and environmental change. And linking policy with environmental change, a specific example of this was a somewhat controversial change in the Chula Vista District Wellness Policy to eliminate chocolate milk from all school cafeterias. Students in our target population that were first exposed to 5210 were interviewed on public radio with a memorable quote, "If we shouldn't have sweetened beverages, as 5210 states, then why does the cafeteria serve us chocolate milk?" End quote. The school district has stopped serving all flavored milk as part of its school meal program. This was an unexpected result and demonstrates the benefit of linking policy changes with the environment and testing feasibility on a small scale to identify barriers before implementation on a broader scale.